had this idea because one of the YouTubers, Bailey Syrian,
she does Murder, Mystery, and Makeup Monday.
I just thought that was super cool because she's like doing makeup, which she loves. Also talking about mysteries, which she also loves. So I thought maybe if I tweaked that to something that I like, could work.
I'm a nursing student. I thought maybe I could use some of the stuff that I learned, talk about that while I do my makeup. Then I got something to talk about.
This could be an epic fail.
I just hope that maybe we can learn something together and this can be educational, because that's all I want out of this. Plus it helps me review because I gotta take that NCLEX next summer, so.
Whatever.
Yeah, let's get into it. So, I don't want to start off with anything too complex because then I just feel like it's not gonna be interesting if I do that. So we're gonna start off by talking about vital signs.
I feel like that's a good place to start.
So, vital signs. What are vital signs? Vital signs are actually a clinical measure that reflects a patient's body function and is regulated through homeostasis.
That's like my whole high school career is like homeostasis. Everything was homeostasis.
So when people talk about vital signs, they're actually referring to a set of 5 measures that include temperature, pulse, blood pressure, respirations, and also saturation of oxygen. So 5 measurements all under the umbrella of vital signs. So there's a couple different times that, we as patients get our vital signs checked, and also we, if you're in the healthcare, would check vitals. It would be upon nursing assessments or discretion, just meaning as in they can kind of do it as they see fit. So like screenings or doctor's appointments.
Usually when you go to the doctor, most of the time you're probably gonna get your blood pressure and your temperature taken.
Upon admission to the hospital or admission to wherever, certain medications that are given during emergency situations, and also before and after procedures or surgeries.
Also, just a disclaimer here, I am no professional, I am not a professor or I don't know everything. I'm just trying to, use what I've learned, my notes, my knowledge, and review from it, doing something I like to do, because I like to do makeup. And yeah, so that's just my disclaimer. Don't come at me.
So there's a couple different factors that we use when we're determining how frequent we need to do vital signs. One of those being...
I'm just going to talk as in I'm being the nurse and I'm talking to other people that are going to be nurses or whatever, because it's just too difficult for me to go back and forth.
Anyways, so comorbidities. That just means that the patient have 2 or more things going on. So, for example,
COPD and asthma and diabetes, all 3 of those things, those would be considered comorbidities.
Their diagnosis, what kind of treatments they're getting, their level of acuity, which is a fancy word for just saying the severity of what they got going on.
It's not very invasive, so it's a good way to keep track of how the patient is doing.
I'm gonna go into talking about ranges, and when I'm saying ranges, I'm just talking about the average. It's important to remember that not everybody is going to fall in the average or around the average, and that's completely okay.
Don't come at me about that either.
For temperature, it's 35.9 degrees Celsius to 38 degrees Celsius, and that is 96.7 to 100.5 degrees Fahrenheit. Pulse. That is 60 to 100 beats per minute. Most people are around 80, in the 80s. Blood pressure, everybody, 120 over 80.
As long as you know what your normal is,
And respirations is 12 to 20 breaths per minute. Saturation of oxygen, we usually like to see it around 95 or higher. So temperature. So the hypothalamus is actually the body's thermoregulator, and there are thermoreceptors throughout your body that will react to heat and cold, and that's what triggers your body to shiver or sweat in response to try to equal out or maintain the homeostasis of your temperature.
Sure, it's important that we remember that there are many ways that our body loses heat.
Yeah, so sources of heat loss, the biggest one is through your skin and also through evaporation of sweat.
And I've literally been going through with this color for the past like 20 minutes.
Warming and humidifying inspired air, like through our nose and such. So there's a couple things that influences our body temperature. One of that is circadian rhythm. So circadian rhythm, we want to think 24 hours, morning, night, and with temperature specifically, we're talking about how in the morning our temperature is probably going to be lower, and then at night, temperatures like to spike or increase. That's one of them. Another one would be like females tend to have higher temperatures than males. Your age, your activity levels, environmental temperatures, stress. We tend to refer to a person that has a fever as being febrile, whereas somebody who does not have a fever is considered to be afebrile, because we want to remember that a in front of a word typically means not. And with febrile meaning fever, afebrile will mean...
I don't even know if I'm pronouncing it right, but...
Afebrile means without a fever. Couple different types of fevers when it comes to talking about like does it come and go? That would be intermittent. There is remittent, sustained, and relapsing. And relapsing is very common to see in children. And relapsing just means that they'll have a fever for a couple days, and then it'll go away for a couple days, and then it might come back for a day, and then it goes away. When we have a fever, we want to reduce it, and some of those methods of reducing fevers would be antibiotics, which we only give antibiotics if there is a bacterial infection.
So...
Antipyretics, which would be like ibuprofen, acetaminophen. Non-pharmaceutical ways that we can reduce a fever is like cooling blankets, cold wet washcloths, ice packs, stuff like that. The ways that we check temperatures is, the most common is across the forehead. You can do it in the ear, orally, axillary, which means under your armpit, and the most accurate is yonder, but nobody really likes that. So normal pulse rate, like I said, the range is 60 to 100 beats per minute, is actually the number of contractions over a peripheral artery in 1 minute. And this can be altered by activity, stress, pain, because if you're in pain, your heart rate's gonna go up, heat or cold, and disease processes. And disease processes is just a fancy way of saying like when you're sick. So you can have abnormalities of your pulse rate with like, you could be tachycardic, which means you have a pulse that's over 180. Bradycardic means your heart rate's under 60. With tachycardia specifically, it really means that the heart rate is beating faster, but that doesn't always mean that it's pumping as much blood. And when we're checking for our pulse rates, we want to not only note the number of beats per minute, we also want to check out the characteristics of it. The quality of it, like the rhythm of it. Is it thready? Is it weak? Is it strong? Is it bounding? Is it regular? Is it irregular? Like, is it skipping? These are all very important qualities. Regulated by the autonomic nervous system, which just means you can't control it. You can't just think to stop your heart and it's gonna stop. Like, there's a couple different sites that we can use to assess your pulse. Some of them being your carotid, your radial, your brachial, your femoral, which is in your leg, your popliteal, which is the back of your knee, and then like the dorsal pedis and the post-tibial.
The biggest thing out of that one is to remember that you're not just assessing for your number, you're also assessing for the extras, the characteristics.
I'm just in the zone. Moving on to respirations. So, respirations is breathing. Eupnea. That just means normal breathing. fancy word. Tachypnea, which going back to what we've already talked about, is very fast breathing. Bradypnea, that would be slow breathing. Dyspnea, notice that they all end similarly. Dyspnea is difficulty or trouble breathing. Orthopnea, that would be difficulty breathing while lying flat or lying down. And then apnea, like sleep apnea, is where you kind of stop breathing. No breathing, apnea, no breathing.
Well, when we're assessing respirations, we're really just looking at their chest or, where you can see them breathing and counting them, how many times they go in a minute. And the important thing to note here is that you really don't want to tell them, like, hey, I'm going to be assessing your breathing, because then they're going to be like, and then they're going to change their breathing pattern. Even if they don't do that, they're going to probably do it subconsciously. What I was taught was, while you're taking their pulse and asking them, like, I take your pulse, just bear with me. You do that for a minute, and then you just keep going for another minute, but instead of watching their, counting their pulse, you actually count their respirations, which is kind of cool. But that way you know that they're not subconsciously changing their breathing pattern or anything like that.
So the whole point, or the physiology of promote delivering oxygen to your body and also get rid of the CO2 that your body has made while doing its thing. So some things that can affect respiration rate would be exercise or activity, stress. You also have voluntary control over it, so that's the thing. Certain medications, fluid electrolyte balance, trauma, infection, stuff like that. Pain, it's also another one.
Talking about auscultating or listening to the lung sounds, you really want to do, or what I was taught was 6 on the front, going from one side to the other to compare the lung sounds from one lobe to the other. 6 on the front, 2 on the sides, and then the 6 on the back. Just to make sure that we're really trying to cover all of the lung base, all the lobes and such.
Also, to tie in with respirations would be SpO2, which SpO2 is where they put that little thing on your finger and see how well the blood is getting and oxygenating your extremities, your fingers and such. But they can also do it on your earlobe, they can do it on your toes, wherever they can really get a good hold of.
I finished up my eye makeup off camera because it's just too hard to talk while I'm trying to do some of this stuff like eyelashes and such. I figured we could finish up our little chit chat while I finish up my makeup. I said it before and I'll say it again, I literally suck at putting eyelashes on.
So,
Blood pressure is interesting, I think, at least. The definition would be the force that moving blood has against the arterial walls. And like I said earlier, the normal range is usually around 120/80. That top number is what we call the systolic blood pressure, where the bottom number is considered the diastolic.
And that just has to go into Kortkoff sounds, and the first sound that you hear would be the systolic when you're taking it, and the last sound that you hear would be considered the diastolic. And I'm not going to really get into that because that's really all you really need to know.
So, as the blood is going through your arteries, it's going to make your arteries expand, and as the blood leaves the section of the arteries, it's going to make it contract back down.
That's basically blood pressure, kind of, in a very summed up manner.
Hypertension, or we like to abbreviate it as HTN. So hypertension is increased blood pressure for a sustained amount of time, basically. Usually it's above 140/90, I believe. Don't quote me on that, because I'm way in the beginning of my stuff and we didn't talk about this till way later, so I'm going off memory here. I think it's around 140/90, and it has to be on 3 separate occasions or more.
But maybe if I continue to make these videos, we can get into it later, because I really did like that lecture. That's a fun lecture.
You can have hypotension, because hyper meaning more, hypo meaning less. And that's just lower than average, and some people can have low blood pressure and it be considered normal, because everybody's normal is different. There's also orthostatic blood pressure, which is where you take somebody's blood pressure 3 separate positions. One being while they're lying down, one being while they're sitting up, and the last one being while they're standing. Each time you take it, it's about 60 seconds between each, to see if their blood pressure drops. It can be associated with like dizziness, faintness, weakness, while they're doing this, and it's a thing. Some people can actually be at risk for having this, and some risk factors include older adults, prolonged bed rest if they've been sitting in bed for a long time, like hospitalized patients, dehydration or excessive blood loss. Because I mean, think about it, when you lose a lot of blood, like you stand up and it's like certain medications can make you have that. There's a lot of things that can affect blood pressure. Some of them being like emotional status. If you're really upset, your blood pressure is probably going to be high. Body positioning, as I said with the orthostatic blood pressure, that definitely plays a role. Age, gender, what kind of food you eat. Nutrition is seriously important. When we're entering the room, we do WIPSA, we call it WIPSA. W stands for washing our hands. You always want to wash your hands. I is identifying yourself and the patient. Can I get your name and date of birth? And they're going to tell you whatever, Jane Doe, blah, 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 blah. You're going to make sure you're in the right patient's room by checking it with your records. To P for privacy, close doors, and you want to close the door when you come in, obviously, but close any curtains or anything like that. E is for explaining what you're doing. S is for safety, so you want to make sure that it's a safe environment, that you're not putting the patient at risk, like you don't raise their bed up all the way. Don't raise their bed up to high heaven. Good Lord. Oh, and I forgot to mention allergies. You want to ask them for allergies. When you're all done, you're just gonna ask them, is there anything I can do for you or get for you, or do you have questions for me?
Hopefully you had fun listening to me rant about vital signs. I thought this was the coolest idea, even though it wasn't fully my idea or anything. I just took Bailey's idea and made it into something that would fit me. And I thought, hey, I can be educational and maybe help other people learn something, review my material while I'm at it, and yeah, it could be fun. This isn't supposed to be for medical diagnoses or something. Please don't come at me for that. Yeah, I hope you had fun. I sure did. I hope you enjoyed. Make sure you like and subscribe. Comment on maybe a topic you'd like me to talk about. Yeah. And make this world a better place. Help others. That's what matters.